Hi, I'm Dr. John Bergman, corrective chiropractor in Huntington Beach. I've got to tell you about a device that I've been using for over 20 years. It's developed by a friend of mine, Dr. Richard Graham, and he developed this amazing elliptoid decompression device. Has a chiropractor's and, as the general public knows, forward head posture, that head going forward from the result of trauma, office, and we call it now tech neck, where people are looking down at their cell phones. It's devastating. Not only does that compromise the nerves that support the shoulder, elbow, wrist, breathing, respiration can be affected. So the most vital aspects to appropriate biomechanics or how the body moves is to restore that curve and maintain that curve. And with office work, with sports, with driving, that it's almost like the world is designed to straighten that curve in the neck. So what can you do? Obviously corrective chiropractic care. But what is the greatest supportive exercise known to mankind? It is the posture pump. This posture pump is effective and supportive. I prescribe it, I use it, I recommend it highly. I've got to tell you, one of the most challenging problems being a corrective chiropractor is to restore that natural curve, but also not only restoring the natural curve, which you can do with corrective adjustments, but how do you maintain it? How do you stabilize it? How, once that curve is restored, how do you maintain the integrity of that curve? I'll tell you right now, posture pump, baby. Posture pump is the #1 exercise that I prescribe in my practice through my patients, and I even have my family use it. Now, this is the greatest in elliptoid decompression that you're ever going to find. Now, they've come up with a new head support device. Make sure this has low to where it nearly touches the shoulders. The neck is centered. This goes down low over the eyes, so almost like the old riverboat gamblers. You're going to apply this so it stabilizes. Now what you want to do, this inflates that bulbous air doing the elliptoid decompression, this deflates it. And so what you want to do is increase the pressure up until the comfort level. Let me know when that's just reaching the level of comfort. Good. Okay, and then you're going to decrease it, and you'll do this up to that same level of discomfort. Once we reach that, we're going to leave it there for about 3 to 4 seconds, and we'll do this over a 2-minute time frame. And what that's going to be doing is it's going to be forcing and hydrating those discs, because remember, discs get their nutrients through imbibition, and which is movement. So they're forcing them along that opening aspect in that elliptoid movement. Now, once you've done that for 2 minutes, then you're going to go up. Now let me know when we've reached the limit where you're comfortable. Good. Okay, now when we're at this level, you're going to deep breathe. So after you've warmed up for 2 minutes, she's going to be deep breathing during the inflation of this. And your goal is to get up to 20 minutes. It's actually 18 minutes. That's when the human spine crosses that plastic elastic deformation curve, where the tissue in the spine has maintained that plastic deformation into a normal configuration. So you maintain it for that long, deep breathing. And the goal is to get up to that 20-minute mark. And then when she's done, she can reduce the pressure, has ease. And this is one of the greatest supportive exercises to correct forward head posture, reverse curves in the neck, neck trauma. It is absolutely essential. It's one of the devices that I've been using for over 20 years. Posture pump.